because so many people hear about Ibogaine for addiction, and not as much about trauma. And we started seeing at Crossroads, which was Martine's clinic at the time, veterans who were coming down for opiate dependence, and they were healing their post-traumatic stress from combat. And then a lot of the underlying the combat PTSD was childhood PTSD, because a lot of people often join the military in some cases because of hard upbringings and wanting, college tuition or professional support. Um, and so we were seeing people coming in for addiction, and their PTSD was resolving their post traumatic stress as well as their childhood trauma. And so I like to think generally of Iboga and Ibogaine as a globally like detoxifying medicine. And we know it detoxifies people in a really pronounced way from substance use disorders and detoxifying opiates out of the system. But it also detoxifies the mind. It detoxifies fear that resides deep in the mind. It detoxifies memories that were traumatic in someone's life. It helps to detoxify stuck negative emotions in the body, like shame, rage, all the things that can get wrapped around trauma, self-hatred, low self-esteem. And it sort of brings these emotions, these memories to the surface in a way that we've actually seen on brain scans before and after Ibogaine, where there's increased blood flow to brain structures where trauma is thought to reside, which can be like the limbic system, the amygdala, the cerebellum. These are very early parts of the brain that develops like early in life. And a lot of where the circuitry of trauma, where people talk about fight, flight, freeze responses, or, people talk about the sympathetic, parasympathetic, when someone's in trauma, their sympathetic nervous system, they're stuck in a fear state. They're still operating from the past based on old fear programming and old stories. That's literally in the brain circuitry. And so there's still a lot of research to be done, clearly, because there's very little brain scans that have been published on Ibogaine. But I think Ibogaine is working and Iboga are working in a deeper way than other psychedelics, specifically in those really early parts of the brain. Like when we're babies, the cerebellum, which is kind of like the brain behind the main cortex, that develops first. And that's where you can have all kinds of infant trauma, childhood trauma that you can't consciously access through language or through more evolved parts of your brain, like your frontal lobes. And so it's common when people take Iboga to feel like it's a kind of a rebirth experience, that it takes them back to early childhood memories that may have been traumatic. And some of the trauma is so what we might say like unconscious or subconscious. People couldn't in therapy consciously talk about it. They couldn't tell you what happened to them. But their body has been through experiences in their lifetime that have clearly had an impact. So it's very common that a lot of the trauma can be in the gut brain. People talk about the gut brain being like the second brain. And a lot of trauma is connected from these deep parts of the brain through the vagus nerve into the gut. And it's common on Ibogaine and Iboga for people to sometimes vomit or feel like deep kind of almost like a surgery in their stomach where there's things that are coming out, and they'll have flashes of memories or awareness that are connected to sensations that are happening in their stomach. So Ibogaine and Iboga are so complex. There's probably hundreds of ways that these medicines help trauma. On the neurotransmitter level, if you have PTSD and you go to your doctor, they might give you like Wellbutrin or an antidepressant that's trying to regulate serotonin. But a lot of people with trauma end up in addiction because they're trying to self-medicate and self-soothe pain. A lot of times why people with trauma end up hooked on opiates or other substances. And Iboga is this kind of master conductor symphony of neurotransmitter activity. It's working on not only like serotonin and dopamine, like a lot of the antidepressants, but it's working on the opiate receptor system. It's working on NMDA or glutamate, which is partly what ketamine does. Um, it's working on something called sigma receptors, and sigma receptors are connected to memory processing. So is NMDA, but there's aspects of Ibogaine that's working on the memory centers of the brain. And people commonly talk about Ibogaine as like a defrag, or a reset of the memories, and they'll see sort of like a movie reel of past memories, or like a Rolodex of scenes from their life. And I think there's something with the pharmacology of Ibogaine that's helping the memory reprocessing. So it's rewriting the stories in a way that's like with the trauma, like if you're a child, it's not your fault. This wasn't your fault. You were exposed to this. There was chaos in your environment. You don't have to internalize the shame that, from what happened to you. And then there's all kinds of growth factors in Ibogaine, like GDNF and BDNF, that help, I think, carve new pathways and new brain plasticity so that people can write a new story in their own mind. And so there's a lot to it. But I would say that one Ibogaine and Iboga experience for me is as effective from what I've seen as the 3 MDMA sessions, like for example, in the MAPS protocol, which is evidenced by Nolan Williams' recent study, where there was all these veterans with chronic brain injury and PTSD, and in like one session, they all fell out of the clinical range on post-traumatic stress disorder. And I think it speaks to the complexity of Ibogaine. It's much more complex pharmacologically than MDMA. It's a natural medicine, and it stays in your system for weeks versus MDMA, which is kind of out in like 72 hours. It's still working for weeks. So you have this window to really kind of come back into grounding and presence. And then I would also say with trauma, a lot of people can be dissociated or disconnected from their bodies. And it's like a survival mechanism. It's hard to like feel at home and present in a body that's been traumatized. So people tend to sort of be more in their head, or disconnected from even physical sensations in their body. And Iboga and Ibogaine bring you deeply, deeply into your body. People report feeling so much more deeply connected to physical sensation and presence, and even just mentally far more present. And what we see in trauma is that, in PTSD, is that people have, it's hard to be in the present moment. They're thinking about the future or what could happen, or they're stuck in fear. And it's pretty universal, I'd say, with Iboga and Ibogaine, even if people don't have visions, that afterwards they feel arguably like the most grounded they've ever felt in their whole life, and present, and the mind is quiet, which is one of the greatest gifts for someone who's had a very loud sort of, monkey mind, or worry, or, just